6 Early Warning Signs of Dementia to Watch for, Senior Care. Alzheimer's disease and other forms of dementia are progressive neurological conditions affecting over 55 million people worldwide, according to the World Health Organization. They are a leading cause of disability and dependency among adults aged 45 and older. Many mistakenly believe dementia is just a normal part of aging, but this is a misconception. The disease often begins decades before obvious symptoms emerge. Recognizing early warning signs can slow its progression, enhance brain health, and improve quality of life for individuals and their families. Today, we'll explore 6 subtle yet critical early signs of dementia that are often overlooked. Early detection empowers you to take proactive steps toward better health. Please note that this video is for informational purposes only. Always consult a healthcare professional for medical advice. Before we dive in, let me share a story that's close to my heart. My Aunt Clara was the soul of our family. She'd light up every reunion with her quick wit, knit scarves for everyone, and never miss a chance to dance to her favorite jazz tunes. A few years ago, we noticed small changes. She'd pause mid-sentence, struggling to find words. She tripped on stairs she'd climbed for decades. Her knitting needles gathered dust. At first, we chalked it up to aging. But a visit to her doctor revealed these were early signs of dementia. That diagnosis was a gut punch, but it also gave us hope. We adjusted her diet, enrolled her in exercise classes, and cherished every moment we had. Clara's still with us, and though her journey isn't easy, early action helped her stay engaged longer. Her story drives me to share this knowledge with you, because noticing these signs isn't just about medicine, it's about preserving who we are. 1. Symptom 1. Changes in posture and gait. Movement tells a powerful story about brain health, and subtle changes in how someone walks or stands can be an early clue to dementia. As cognitive functions decline, the brain's ability to coordinate balance and motor control weakens. You might notice shorter, shuffling steps, as if the person is hesitant to lift their feet. Dragging feet or a slumped posture, shoulders hunched or body leaning to one side, can also appear. These changes are often dismissed as just getting older, but they may signal neurological shifts deep within the brain. For instance, someone might struggle to navigate familiar spaces, like their own hallway, or hesitate when stepping over a curb. Simple tasks, like holding a coffee mug or using a fork, may become clumsy, leading to spills or frustration. A 2020 study from the National Institute on Aging found that motor changes can precede memory issues by years, acting as an early warning. I saw this with Clara. Her uneven steps on her porch were a clue we initially overlooked. These changes increase fall risks, which can be devastating for older adults. The CDC reports that falls are a leading cause of injury among seniors, and dementia-related motor issues amplify this danger. The brain's motor cortex and cerebellum, which govern movement, are affected early in some dementias, like Alzheimer's or vascular dementia. These regions rely on healthy neural connections, which deteriorate as the disease progresses. Over time, these subtle signs can worsen, impacting mobility and independence. But early detection offers hope. If you notice these signs, don't ignore them. Consult a healthcare provider to rule out other causes, like arthritis, Parkinson's, or medication side effects. A neurologist may recommend tests, like an MRI, to assess brain function. Physical therapy can strengthen muscles and improve balance, while exercises like Tai Chi, recommended by the Alzheimer's Association, reduce fall risks. At home, clear walkways, install handrails, and use non-slip mats. Encourage gentle activities, like walking or stretching, to maintain mobility. Clara's physical therapy sessions helped her walk more confidently, giving her more time at home. Start small, but act early to preserve independence. 2. Symptom 2. Sensory challenges. Dementia doesn't just cloud memory, it reshapes how the brain interprets the world through our senses. Sensory challenges can emerge early, affecting vision, hearing, smell, and spatial awareness. Depth perception issues might make pouring liquids or climbing stairs tricky. Someone might misjudge distances, spilling water or tripping on steps. Spatial awareness problems can cause bumping into furniture, or feeling disoriented in crowded places, like a busy grocery store. Smell and taste often fade first. A 2018 study from the Alzheimer's Association found that an early loss of smell is a strong predictor of Alzheimer's, sometimes appearing a decade before memory issues. For example, someone might not notice spoiled food or lose interest in favorite meals. Clara stopped enjoying her famous apple pie, which we initially attributed to taste bud changes. These sensory shifts stem from damage to the brain's olfactory bulb, a region hit early in dementia. Hearing challenges are another red flag. Untreated hearing loss in midlife raises dementia risk by up to 50%, per a 2021 study in The Lancet. The brain works harder to process sounds, draining energy from memory tasks. Noise sensitivity, wincing at loud sounds, or trouble distinguishing voices in a noisy restaurant can also signal early issues. A friend's father withdrew from family dinners, frustrated by his inability to follow conversations. A hearing aid restored his confidence, keeping him socially engaged. These sensory changes aren't just inconveniences, they isolate people, reducing social and cognitive stimulation, which accelerates dementia's progression. The brain relies on sensory input to stay sharp, so addressing these issues is critical. See a doctor to explore causes, like ear infections, cataracts, or medication side effects. An audiologist can test hearing, while an eye doctor can check vision. Hearing aids or glasses can make a huge difference. The National Institute on Deafness recommends annual hearing checks for adults over 50. At home, use brighter lighting, reduce background noise, and label items to ease navigation. Encourage sensory-rich activities, like gardening or cooking, to stimulate the brain. Clara's family added labels to her kitchen, helping her stay independent longer. These small changes support brain health and confidence. 3. Symptom 3, muscle weakness. Muscle strength and brain health are intricately linked, yet this connection is often ignored. A 2019 study in the Journal of Gerontology found that reduced grip strength in older adults predicts a higher dementia risk. Struggling to open jars, carry groceries, or grip a railing firmly might reflect early neural changes in the brain's motor pathways. General frailty or muscle loss, sarcopenia, can also accelerate cognitive decline, as physical inactivity reduces blood flow and oxygen to the brain. I saw this with a colleague's father, Tom, an avid gardener who began dropping tools and avoiding his flower beds. At first, we thought it was arthritis, but tests revealed early dementia. Muscle weakness isn't just physical, it's a brain signal. The motor cortex, which controls voluntary movements, weakens as neurons degenerate. This can lead to broader frailty, limiting activities like walking or dancing, which are vital for brain health. A 2022 study in neurology linked physical inactivity to faster cognitive decline, creating a vicious cycle. Weakness also affects daily life. Someone might avoid social outings due to fatigue or fear of dropping things, leading to isolation. Tom's withdrawal from his gardening club was a red flag. But there's hope. Strength training can break this cycle. Exercise boosts neuroplasticity, helping the brain form new connections to compensate for losses. Consult a doctor to assess weakness, ruling out causes like vitamin D deficiency or thyroid issues. A physical therapist can design a safe strength program, like resistance bands or light weights. The CDC recommends 150 minutes of moderate exercise weekly, including 2 strength sessions. Community classes, like Silver Sneakers, offer senior-friendly workouts. At home, try chair exercises or grip trainers. Tom's weekly strength class helped him garden again, lifting his spirits. Encourage small, consistent efforts to protect both body and brain. The Alzheimer's Association has free exercise resources for seniors. 4. Symptom 4, sleep disturbances. Sleep is your brain's nightly reset, clearing toxins like beta amyloid, a protein tied to Alzheimer's. Persistent sleep issues, insomnia, frequent waking, or excessive daytime sleepiness, are early dementia warning signs. Vivid nightmares, night terrors, or restless movements, like kicking or talking during sleep, may indicate REM sleep behavior disorder, strongly linked to dementia with Lewy bodies, per a 2020 study in sleep. Poor sleep isn't just a symptom, it's a risk factor. Chronic sleep deprivation fuels brain inflammation, hastening cognitive decline. A 2021 study in Nature found that less than 6 hours of sleep nightly doubles dementia risk. Daytime fatigue can also mimic dementia symptoms, like apathy or confusion, complicating diagnosis. Clara's sudden napping habit, unusual for her, was a clue we missed. Other signs include trouble falling asleep, waking multiple times, or waking too early without feeling rested. These disruptions stem from damage to the brain's sleep-regulating regions, like the hypothalamus. Sleep apnea, common in older adults, worsens the problem by starving the brain of oxygen. A neighbor's apnea diagnosis transformed her energy after CPAP treatment. Addressing sleep issues early can protect cognitive function and slow dementia's onset. See a doctor if sleep problems persist. A sleep study can diagnose apnea or other disorders. The National Sleep Foundation recommends 7 to 9 hours of quality sleep nightly. Create a calming routine, avoid caffeine after noon, limit screens before bed, and keep a consistent schedule. Relaxation techniques, like meditation or deep breathing, can help. Clara's bedtime herbal tea ritual improved her rest. If nightmares or movements occur, a neurologist can assess for REM disorders. Prioritize sleep, it's a powerful shield for your brain. 5. Symptom 5, apathy and social withdrawal. Losing interest in life is more than a mood swing, it's a hallmark of early dementia. Apathy, distinct from depression, manifests as a lack of motivation, flat emotional responses, or disinterest in hobbies, work, or social events. Someone who loved family gatherings might skip them, seem detached in conversations, or stop pursuing passions. Clara's untouched knitting needles broke our hearts, she'd once knitted for every grandchild. Apathy stems from dementia's impact on the brain's prefrontal cortex, which regulates emotions and social behavior. Unlike depression, it's often persistent and unrelated to external triggers. A 2019 study in JAMA Neurology found that apathy predicts faster cognitive decline, as it reduces mental stimulation. Social withdrawal compounds this, starving the brain of interaction, which is vital for cognitive health. This symptom is tricky because it's easily mistaken for aging or sadness. A friend's mother stopped attending book club, claiming she was just tired. Her dementia diagnosis revealed apathy as the cause. Early intervention can rekindle engagement, slowing decline. But ignoring it risks isolation, which accelerates dementia's toll. Gently encourage participation in low-pressure activities, like a walk or a favorite hobby. Consult a doctor to distinguish apathy from depression or medication effects. A therapist can suggest strategies, like cognitive behavioral therapy, to boost motivation. Community programs, like senior centers or art classes, foster connection. The Alzheimer's Association offers support groups for patients and families. Clara's painting class brought back her smile, even on tough days. Small steps toward engagement can preserve emotional and cognitive health. 6. Symptom 6, word-finding difficulties, aphasia. Struggling to find the right words is one of dementia's most recognizable early signs. Aphasia manifests as pausing mid-sentence, using incorrect words, for example, shirt instead of jacket, or repeating phrases. Forgetting familiar names, even of close family, is another clue. A friend's mother called her son that man, a heartbreaking sign of early Alzheimer's. These issues can appear years before diagnosis, per a 2020 study in neurology, and worsen communication over time. Aphasia arises from damage to the brain's language centers, like the temporal lobe. It's not just forgetting words, it's a breakdown in processing language. Someone might repeat themselves, lose their train of thought, or struggle to follow conversations, especially in noisy settings. This can lead to frustration or withdrawal, as communication feels like a battle. Clara's pauses during storytelling were subtle but persistent, a sign we later connected to dementia. Early aphasia is often mistaken for stress or aging, but its progression sets it apart. It's not about occasional tip of the tongue moments, it's a pattern that disrupts daily life. Addressing it early can maintain communication longer, preserving relationships and confidence. See a neurologist to assess aphasia, ruling out stroke or medication effects. Speech therapy can strengthen language skills, while apps like Lumosity offer word exercises. The National Aphasia Association recommends practicing conversations or reading aloud. Encourage patience in family discussions, rushing can worsen frustration. Clara's word games with her grandkids kept her engaged. At home, use visual cues, like labeled photos, to aid recall. Early intervention empowers communication, even as dementia progresses. 7. What to do if you notice these signs. If you spot multiple signs, act fast, seek medical advice. A healthcare provider can rule out treatable causes, vitamin B12 deficiency, thyroid issues, medication side effects. Early diagnosis opens treatments, like cholinesterase inhibitors, that slow decline, per the Alzheimer's Association. It allows planning, legal, financial, caregiving, for safety and dignity. A comprehensive evaluation, cognitive tests, blood work, MRI, confirms dementia. Don't let fear delay action. Clara's diagnosis let us adapt her home with grab bars and labels. Share concerns with family, involve them in doctor visits. The National Institute on Aging offers free dementia care guides. Early steps preserve independence longer, easing the journey for everyone. No cure exists for dementia, but lifestyle choices cut risk or delay onset, backed by research. Here's how to safeguard your brain, with practical, science-driven tips. Your brain thrives on challenge, building cognitive reserve to resist dementia. A 2021 neurology study links stimulating activities to a 30% lower Alzheimer's risk. Learn new skills, play an instrument, solve puzzles, study a language. Reading, classes, or debate strengthen neural connections. Clara's crosswords kept her sharp. Apps like Duolingo or community courses make learning fun. Social activities, book clubs, chess, boost cognition. A 2022 JAMA study found social engagement halves dementia risk by fostering resilience. Join a local group or volunteer. My friend's mother found joy in a senior choir, sparking memories. Start small, read a book weekly, try a puzzle app. These efforts build a robust brain, delaying symptoms even if pathology exists. Exercise is a dementia-fighting powerhouse, boosting blood flow and neural growth. A 2020 Lancet study linked regular activity to a 40% lower risk. Aim for 150 minutes of moderate exercise weekly, walking, swimming, cycling. Strength training, resistance bands, light weights, enhances neuroplasticity. Physical activity protects cardiovascular health, critical for brain function. A 2021 JAMA study found aerobic exercise slows brain shrinkage in early dementia. Gardening, dancing, or Tai Chi count too. Tom's gardening kept him active, lifting his mood. The CDC's senior exercise guides are free online. Start with 10-minute walks. Building consistency. Community classes like Silver Sneakers make it social. Nutrition fuels brain health. The Mediterranean diet, lean proteins, healthy fats, whole grains, vegetables, cuts dementia risk, per a 2019 JAMA study. The Mind diet, a hybrid, emphasizes berries, nuts, greens. Avoid processed foods, sugars, trans fats, they inflame the brain. The ketogenic diet shows promise but needs medical oversight. A 2022 neurology study found it improves cognition by supplying ketones, an alternative brain fuel. Experiment with Alzheimer's Association recipes, berry smoothies, grilled fish. Hydration matters too, dehydration mimics dementia symptoms. Clara's family added fruit-infused water, perking her up. Small dietary tweaks, swapping soda for tea, build long-term brain health. Diabetes, hypertension, obesity raise dementia risk by damaging brain vessels. A 2022 diabetes care study linked controlled blood sugar to slower decline. Monitor blood pressure, cholesterol, weight with checkups. Medications, diet, exercise manage these. Clara's adjusted diabetes meds helped her cognition. High blood pressure causes vascular dementia by reducing brain blood flow. Obesity, especially visceral fat, inflames the brain, per a 2021 Lancet study. Weight loss through healthy habits cuts risk. Sleep apnea, depriving the brain of oxygen, worsens memory. Treatment, CPAP, improves cognition. The American Heart Association's tracking tools help. Deep sleep clears beta amyloid, per a 2021 Nature study. Less than 6 hours nightly doubles dementia risk. Aim for 7 to 9 hours. Poor sleep mimics dementia, apathy, confusion. Clara's napping was a clue. Maintain a regular schedule, avoid screens, limit caffeine. Dementia is daunting, but early detection transforms outcomes. Notice changes, gait, senses, strength, sleep, apathy, words, then act. Consult a doctor, embrace healthy habits, plan ahead. Clara's journey taught me small steps today preserve what matters tomorrow. Lifestyle changes, exercise, diet, sleep, learning, build a resilient brain. Emerging treatments offer hope, but your actions now shape your future. This journey is personal. Maybe you're worried about yourself or a loved one. Share your thoughts or questions in the comments, we're here to support. Subscribe, and hit the bell for more health tips. Take one step today, a walk, a puzzle, a doctor's call. To invest in your brain. My family's story with Clara shows every choice counts. Let's build a healthier tomorrow, together.